In this video, we're showing a simulated patient with hemiplegia or stroke and a simulated caregiver providing some assistance, going through the 33 skills of the wheelchair skills test after training has been received. This first skill involves rolling forward on a smooth level surface. You'll notice a nice smooth pace of the caregiver and her good communication with the person in the chair, coming to a stop close to the wall. In the second skill, she'll be rolling backwards a short distance. 5 meters is the usual distance for the wheelchair skills test. Again, good communication and also getting the sound side foot up and supported so it's not dragging on the floor. And notice how the caregiver is checking over her shoulder on a regular basis to make sure there are no obstacles, and when she's approaching the finish point against the wall, stepping to the side as she does so.
Thanks.
In the third test, stopping on command, this is done in both the forward and backward direction. Again, we see good communication and getting the foot up out of the way. And she'll come to a controlled stop, so slowing down gradually when she's asked to do so, but effectively.
Can you please push her backwards and stop when I ask you to?
And again, coming backwards and coming to a sudden stop, communication, foot up. Shoulder checks. And coming to a smooth, controlled stop. Turning in place is done during the wheelchair skills test over a cross marked on the floor. Good communication, foot up, and turning around in as small a space as possible. On completion of the turn completely around 180 degrees, the chair should be pretty much oriented in the same direction as it was before, except in a different direction. In this case, there's a slight movement to the left, which would be something that could be corrected.
For this skill, can you please move her chair around these cones without hitting them?
During the moving turn skill, we use obstacles get progressively closer together. They start out 2 meters apart with a turn to the right and a turn to the left. The next 2 turns are through obstacles spaced 1.5 meters apart. And finally, between obstacles, 1 meter apart. In this case, to make sure you don't hit the pylon, it's important not to initiate the turn until the axle of the chair is level with the obstacle. This is the same skill, but performed in the backward direction.
Please wheel her backwards around these cones without hitting any of them. Leg up.
Again, communication, foot up. Caregiver watching over her shoulder for the obstacles. Being careful to keep the rear wheel clear of the obstacle. Also in tight spaces, the front wheel will tend to swing a little more widely, as do the footrests and the feet, so that in narrow circumstances, the caregiver will need to watch out for that, as well as for getting the wheels past the obstacles.
Good. Can you please get this wheel as close as you can?
For the maneuvering sideways skill, the caregiver moves the chair forward and backward, much like parallel parking, and uses as few forward-back movements as is convenient, getting the wheelchair as close to the target movable wall as possible. And having done that, she'll move back to the starting position. This is a skill that's very useful in tight spaces, such as in elevators or in washrooms.
Good.
Picking objects from the floor, we use 3 objects, a pen, a coin, a pen, and a cell phone, or things of approximately that size. If the caregiver is doing the work, you'll notice that she lets the Wheelchair user knows what she's doing. She bends down, keeping her back nice and straight, and uses the one hand on the wheelchair to provide a little bit of support when getting back up and for balance. Relieving the weight from the buttocks is important for prevention of pressure sores and should be carried out for at least 15 seconds every 20 minutes or so. Squirming in the chair is also encouraged, frequent movements of various types. For someone with a problem with paralysis on one side, such as after a stroke, the leaning is a useful way to do it. Notice that the casters are swung around in the forward direction, so the chair won't be likely to tip in this during this maneuver of leaning forward, and no forces are placed on the paralyzed arm, which could injure it.
She's going to go from her chair to the mat. Can you just assist her however she needs? Yeah. Okay.
So getting from the wheelchair to another surface is done frequently during the day, whether getting to a toilet or a more comfortable chair or car. Often as many as 10 or more transfers a day are performed in both directions. Notice that the caregiver is supervising what's happening. It would be unreasonable for the caregiver to, by herself, lift the person to the new surface. Notice that the arm comes off the armrest and is moved out of the way, and a sling is used to support the arm. The casters are swung forward, the brakes are applied, the footrests are moved out of the way, the buttocks are moved forward on the seat, and then with a rocking action, the wheelchair user comes to a stand. The caregiver supports her, or would be prepared to support her if necessary, while she pivots and sits back down. The same procedure is used and come in the other direction.
1, 2, 3.
If the knee tended to buckle here, then the caregiver's knee could be placed in front of it to prevent the buckling, as long as the wheelchair user's foot was on the ground. This skill isn't complete until the wheelchair is back in position and ready to move. Arm on the arm support, footrest back in place. The caregiver is assisting as necessary, providing cues or assistance as needed. While the person is out of the chair, we usually assess the folding, which is useful for storage purposes if a wheelchair is infrequently used, or to put it into the trunk of a car. The footrest is removed, the cushion, being careful to remember which direction it came out in. Tipping the chair slightly to the side and folding it prevents any friction from limiting how easily the far side rear wheel moves towards the near side one, such as in gravel out in the driveway. The chair can be further broken down by taking the rear wheels off in some cases, so-called quick release wheels. One of the most frequent difficulties there is not having released the brakes before, or wheel locks before doing so. Finally, the armrests in this case come off and they're removed as well. This greatly lightens the chair and decreases its dimensions so it can fit into the trunk nicely. Having reduced the chair, so-called folding it, then putting it back together is also part of the skill. Notice there that the armrest is an elevating type, so it accidentally became more elevated as it was being picked up, but that was corrected before it was being put back in position. Sometimes the armrest can be put back in on the wrong side, so some care and attention to that may be important. To put the rear wheels back on, there's a little plunger in the center of the axle that should be pushed on that allows the axle to move into the space that's available for it. Once the rear wheels are put back on, then checking that the wheels are well in place is important too. And the footrests often need to be placed back on in the swung out position and then before they're restored to the front position. And the arm trough in this case is one that is slid on and then fold it out of the way to allow the transfer that's about to occur. The cushion is put back as it was with the front section in front. Notice how the caregiver can move the chair even with the brakes on just by lifting the rear wheel slightly and repositioning it for the transfer back into the chair.
Can you open the door?
When getting through a door that opens towards you, then it's important to move the wheelchair out of the way to the side of the door that opens so that the door can be opened easily. And after the door is open, the wheelchair can be assisted in moving through the door, either forwards or backwards, and the door closed behind you. Coming back in the opposite direction with a door that opens away, there's no need to move out of the way of the door. And I should have mentioned that the caregiver should be careful, as she just is there, to make sure that there are no protruding parts like the arms on the armrest that could be scraped on the door while passing through it.
Can you please push her down around the cone and back, and we're going to do 5 lengths, and I'll count them for you.
This is similar to the first skill of rolling on a smooth level surface, except that it's a little longer distance. Again, good communication, good foot placement. The tester can assist in keeping the count. This is 10 meters long, and we're going a total of 50 meters, so it's 5 lengths, I should say. So that would be 2. The caregiver's being careful to make sure that the feet of the person in the chair aren't being struck on the wall at the end or on any other obstacle. And then the final lap.
Great, that's 5.
Next skill is going up a slight incline. This is just 5 degrees.
Please get her up this ramp.
Good communication, supporting the foot. Then the caregiver just has to lean forward a little bit to apply enough force to the push handles to move it smoothly up the surface. When descending the slight incline, the caregiver is in good control and stops part way.
Great. Good.
Sudden stop should be avoided so the person in the chair does not feel as though they're falling forward out of the chair.
Okay, great.
And the push handles shouldn't be too loose and come off in such a situation, so they can be checked ahead of time.
Ramp?
The same thing is done for a steeper incline. In this case, it's 10 degrees. A little more force needed, a little more forward lean on the part of the caregiver.
Sure. Can you please get her down this ramp, but stop partway? Okay. Good.
If the person in the chair tended to fall forward at all, then the caregiver should be ready to remove one hand from a push handle and put it in front of the wheelchair user's shoulder. Moving across the side slope
For this skill, can you please push the chair over this black line without letting any of the wheels drop over the edge?
A 5-degree one, and the chair will tend to turn downhill so that the caregiver will need to counteract that by pushing harder on the downhill push handle. This can be done in the forward or backward
Good.
direction.
Okay, I'm going to set you up for the other side. So I'm just going to turn you around here. Okay, whenever you're ready.
Yep, it's all good.
Good.
Soft surfaces are
you able to
frequently
push her across
encountered.
the surface?
Simple
just pull
carpets
you back,
or
okay?
grass, snow. Because rolling resistance is greater
Anti-tippers up.
with the greater amount of weight that is on the front wheels, we do our best to keep the weight on the rear wheels. This can be done while moving forwards, but
going to tip
it's
you back.
easier to do
Put your foot up there.
in the rear direction.
Okay, you ready?
In this case, the caregiver is going to tip the wheelchair
Okay,
back
here
into
we go.
the wheelie position, just slightly beyond the balance point so that the chair is resting on the hands, and then she
Okay.
can just use the rear wheels to get over the soft surface, doing the shoulder checks as she goes.
Almost there. Okay,
Good.
back down.
This can be done in a non-wheelie position as well, but again, moving backwards is to be preferred. Obstacles
Can you
are
get
frequently
her over this
encountered,
obstacle?
such as thresholds
Okay.
and doorways.
Put your foot up. Ready?
Yep.
Putting a foot on the anti-tipper or tipping lever may allow the front wheels to be tipped up high enough to get over the obstacle.
Can you please
Similar
get her over this gap?
Approach is used for getting over
Leg up, please.
gaps
Ready?
or potholes.
Okay.
Slightly tipping the chair to get the front wheels up, letting them land beyond the gap, and then just moving smoothly over the rear wheels over the
Are
gap.
you able to get her up this small curb?
The small curb
Okay.
is 5 centimeters
Foot up, please.
high.
Ready?
Yep.
Okay.
Using the tipping lever to get the front wheels up,
Forward for me.
and then having the wheelchair user lean forward while getting the rear wheels up to make it easier for the caregiver.
Are you able to get
Coming
her down
down a
this
low
small
curb.
Yep.
Okay.
Foot up, please. You ready?
Can be done in the forward or backward direction. If it's
Lean back
forward,
for me.
you'd want to keep the weight back so there's not a tendency to fall out of the chair.
Good.
Although curb cuts
you
are
able to get her up
often
this
available,
curb? Yes.
high
Okay.
curbs still may be encountered.
Put your foot up for me, please.
In this case,
Just take your
the caregiver will have to move the anti-tippers out of the way by pushing a little button and then swinging them into the upright position. This will allow the chair to be tipped back far enough to get the casters up onto the curb. Don't want to hit the feet on the curb. Careful about that. Warning the person before you tip them.
And now can you lean
And
forward?
then using the person's body weight, notice that the rear wheels are rolling up the curb rather than the caregiver lifting the rear wheels. Coming down the high curb, it's just a reverse.
Are you able to help her get down this curb?
It
Yes.
should not be
Okay.
done in the
How do you
forward
do that?
direction.
I'll get you to put your foot up, please. We're going to go backwards.
Okay.
And similar to coming up the high curb, the caregiver will use the,
Anti-tippers
move
out
the
of the way.
anti-tippers up out of the way, and we'll use the wheelchair user's leaning to help with the skill.
All right. So we're going to just go straight back. I'll get you to lean forward for me, please.
Good communication,
Yep.
leaning forward to get the weight away from the rear wheels as they are rolled gently down. Once the rear wheels are down, the person can sit up straight, and then the chair can be turned to the side to avoid scraping the footrests over the edge of the curb.
Are you able
Getting
to
from
help
the
her
wheelchair
get to
down to the ground and back
to her
up
chair?
again
I think it'd be too
is
hard.
a difficult skill, and it's quite reasonable for the caregiver to refuse to attempt that if that's not something within their
Are you
skill
able to
set.
get her chair in a wheelie position?
Yes.
Okay.
I want you to put your foot up, please.
There are techniques for
Turn
getting
your
back into the chair.
anti-tippers up.
Nevertheless, if a person happens to fall out of the chair, and those can be found in the caregiver manual.
I'm going to tip you back. Are you
For the
ready?
stationary wheelie, this is a necessary skill for some of the other skills to follow. You'll see, like before, that
That's
the
good.
anti-tippers need to be moved out of the
Back down.
way, and then the foot of the caregiver is placed on the anti-tipper to help tip it into the wheelie position.
Are you able to get her in a wheelie position and then turn her around to face that wall?
Sure.
Okay.
Foot up there.
In a tight space,
Tip you
using
back.
the
Are you
wheelie
ready? Yep.
position
Okay.
that can be used for turning around. the footprint
now we're gonna
of
turn.
support needed
Great.
is much less than it would be if all four wheels were on the ground. By doing this over the cross, we can see that just come a little bit farther to the
Okay,
left
and you
than
just bring her down
ideal.
to the center.
Okay, coming down.
And this happens in both directions.
Great, just for the other direction. So this time we're going to go the opposite
The
direction.
tester is just relining the wheelchair up
Okay,
in
whenever
the
you're
starting
ready.
position to be able to better
Very good.
assess whether there's
Okay,
any
taking-
movement when coming in this
taking you back
direction.
again. And now we're going to the left.
If the left wheel is moving back to
Coming
the same
back.
extent that the right wheel is moving forward, then there will be
Good.
no side-to-side overall movement. Rolling forward and
This, what
backward
we'd like
in
you
the
guys to
wheelie
do
position.
Is, I'd like you to get into a wheelie and just roll her chair forward over to the end here. Okay?
Is also a useful
Go back.
skill.
And
We
take you
saw it
back.
a
You
little
ready?
earlier
Yep.
in the backward direction on the soft surface.
Okay, ready to go forward?
Yep.
All right.
Good communication.
Okay, and can you go backwards in a wheelie?
Yep.
Back to where you started.
Still okay?
Yep.
Now the wheelchair can be brought down to the surface with the front wheels on the surface between the forward and backward directions, but there's no need to do so.
Good.
Okay, come back down.
Now, coming down
You
the
wanna
high
get her
curb in the
down
wheelie
this curb in a
position
wheelie?
Sure. Just put your foot up, please. I'll
is an
flip your knee
alternative
tippers up.
way of getting down a high curb. We showed the backward direction, which is simpler in many ways, but
Okay.
more difficult to keep
Bring you to the edge, and then I'll tip you back.
keep one's
okay?
eye on traffic and may interfere with, if you're going long distances, to have to stop at every curb
Okay.
can be
Ready?
Yep.
interfere with progress. So that if the person in the chair is light enough and if the person behind the chair is strong enough, then coming down forward in the wheelie position is quite a reasonable step, just as shown there.
Great.
Similarly,
able
descending a
to,
steep incline
have
in the
her go
wheelie
down this ramp
position
and
is a way
stop
of
partway,
keeping the
but in a
person
wheelie
in
position?
the chair
Yeah.
from
Okay,
falling
see it.
forward out of the
All
chair
right.
if trunk control is an
Okay,
issue.
Put your foot up there, please. I'll flip the anti-tippers up. Okay.
You tip into the
You ready?
wheelie position
Back.
before getting to the edge of the incline. It's much easier than once you're on the incline,
Here we
although
go.
that could be done by turning the chair around in the opposite direction or sideways,
Okay, you can go.
and then turning it downhill to carry on. But this technique is the
Good.
basic method. Some people, with the help of
Are you able
caregivers,
to
are
get
able
her
to
up
get up
these stairs?
stairs.
I think if
Usually
I have
it's
two
not
people.
reasonable for
Okay,
one caregiver
sure.
to do
Let me
so.
grab,
We
please.
recommend
Sure.
the use of
right,
three
just gonna turn you
caregivers
around.
as the most efficient method of doing this.
And I'll flip the anti-tips.
Any tippers are moved out of the way. There's one caregiver up the
Okay, I'm gonna back you up
stairs
here.
and the other two caregivers down below.
All right, can I get you both? Actually, first, Lee, can you take the foot plate off, please?
Move your foot there. Removing the
And
foot plate
you can just,
allows the
cross
caregiver
your
to
legs to hold
grab
that
onto a
foot
part
off
of the
with
chair
your
that will
foot.
not come off accidentally.
Okay, can you each please use your inside hand to hold the frame?
Mhm.
And just watch your backs. And with your outside hand, hold about halfway on the wheel. And I'm going to tip her back first, and then on my count of 3, we'll go up one step, reposition your hands, go up the other step until we get to the top.
Okay.
Sound good?
Yep.
Is everybody ready?
Yep.
Okay, I'm gonna tip you back. Feel okay?
It's important
All
not
right,
to tip the
1,
chair back too
2,
far,
3.
because then the rear wheels will
Good.
tend to roll away from the
Hands
vertical
halfway again
section of the
on
stair.
wheel. 1, 2, 3.
The caregiver on the uphill side
Hands halfway again on the wheel. And 1, 2,
is
3.
not pulling or lifting, just really controlling the degree
I'm
of
gonna
tilt.
set you back down. Everybody can let go.
This is a fairly simple way of
Good. Thank you.
achieving this, and that the two bystanders can be coaxed through it quite easily.
Are you able to get her down these stairs?
With some help, yeah.
Okay.
Again, coming
I'm going
downstairs
to
in the forward
flip
direction.
The anti-tippers up first.
Getting the anti-tippers out of the way, and then we're just repeating the assistance that was
Can
provided
you
earlier.
please swing the footrest out of the way and take it off.
Mm-hmm.
And I'll get you to cross your legs to hold your other foot up. Good. Okay. And can we get a second person to help?
Sure.
Or third,
Can you
I
come
guess?
over and help?
Thanks. Okay. So I'm going to tip you back. I'll get you guys to help me know where the edge of the stair is, please. And then we'll go down each stair one at a time on the count of 3, and I'll tell you where to put your hands and
Okay.
stuff. Just watch your backs. Okay?
Sounds good.
So
Okay,
again,
so I'm going to tip you
the
back
inside
now.
hand attached to the chair
Sharon,
frame.
can you tell me when her wheels are at the edge?
Sure.
Please?
Getting the help of the downhill person to know when you're at the edge of the first step.
Yep, that's good there.
Okay. All right. So inside hands on the frame, please.
Mm-hmm.
Outside hands at the top of the wheel.
Okay.
On the count of 3, we'll go down one stair at a time. Are we
Okay.
all ready?
Yep.
Okay. 1, 2,
Good communication
3.
among the caregivers. Tilt a little bit farther back
Okay,
than
reset the
ideal.
hands
Be a
on
little
top
more
of the wheel.
upright would be
1, 2,
preferable.
3. Reset
But
the
this is
hands once
working
more.
reasonably
Top of
well.
the wheel. 1, 2, 3. And I'll set you down.